Hi everyone, this is Victoria from Elite Medical Prep, and today we are going to be interviewing one of our wonderful USMLE tutors, Jaree, about how to simultaneously study for your USMLE Step 2 CK exam and also your shelf exams during your clinical rotations and beyond. So that sounds pretty busy. I have no idea how to do that. So we're going to go ahead and give Jaree a call to answer all your questions. Hi Jaree, thank you so much for being here today.
All right, thanks for having me, Victoria.
Wonderful. So as you know, today we are talking about your blog post regarding how to prepare for Step 2 CK and also your shelf exams during that super busy clinical year. So the first question that we have for you is just what are your tips on how to squeeze that all in along with clinical rotations? A lot of students really struggle to find time to kind of do everything. They're feeling like they're being pulled in many different directions at
Mhm.
once. What advice do you have?
Yeah, absolutely. So the challenge in step two CK is very different than the one that students face in step one, where at least for step one you're sitting in classes and it feels like you're studying relevant material. But sometimes when you start clinicals, it can feel like there's too many things going on for you to actually focus on clinical learning. So my first tip for finding time to actually study for your shelf and your step while being in clinicals is to try and make your clinical time as educational as possible. So, two things you can do. Number one is whenever you have a patient and you have a little bit of downtime, try to use resources like Up to Date and look up their conditions, look up the common presentations, diagnoses, and treatments for them. Because I find that Up to Date, especially if your school provides access to that, has a really good, concise kind of summary for everything, and it's generally pretty relevant and exactly how you would see it tested on your Step 2 CK or your shelf exam. And so that can be one way to kind of stay engaged, and it'll actually help you learn a lot more about your patients as well. It'll make you look great on rounds and presentations, but then also will provide you some relevant information for your upcoming tests. And then my second tip is trying to be very diligent with your downtime. For example, I'm in a inpatient medical rotation right now, and we have quite a bit of downtime between admitting patients on a long call day. And my most proactive medical students will say, "Hey, I'm going to be over here doing some real world questions. Please let me know when we have an admit or when we need to do something." And they're always really attentive and aware, and it's critical that you perform your duties in the clinic or in the hospital and be a reliable and kind of engaged student. But once you kind of display that responsibility that you can be trusted with that, it's okay to start asking residents, saying, "Hey, I'm just going to be studying, if you don't mind," or, "Hey, if you have any high yield tips for me, do you remember anything from your step two? What kind of advice do you have for me?" I think just being proactive with the limited time you have in the hospital makes it so that when you go home, you're not feeling so overwhelmed like you had an entire day of just doing clinical stuff and now you have to do just studying. I think it's a fine balance, but I think it's doable to kind of combine the two things.
Well, I think that's a great point that you bring up there that once you've kind of established yourself, it is okay to just kind of say, hey, I'll be over here doing my
Mhm.
questions. I do see that that is kind of a point that a lot of students feel like maybe that's not okay, or people will think that they're less focused. So I'm really happy that you say that. You also mentioned getting things done kind of throughout the day so that when you go home, you're not feeling so overwhelmed. But
Mhm.
what advice do you have for students that are still feeling overwhelmed? Because we hear many times that despite trying to, get as much done as you can between your rotations, people are still feeling like, whoa, I have all these shelf exams to study for, as well as Step 2 CK. I'm in over my head. What do I do?
So in terms of students feeling overwhelmed, one thing I wanted to talk about is in your third year, it's a long year. There's a lot of questions to get through. The year world, QBank is always growing, but realize that a lot of these things are related. And so it's okay if you take some time off and just figure out how your workflow is supposed to be throughout the day. Me personally speaking, my first rotation was family medicine, and I had a really hard time figuring out how to study for that and balance the clinic. And
Mhm.
it was really overwhelming for me too. And I didn't touch UWorld for the first 6 7 weeks of my third year, and that's okay. that worked out fine for me because I needed that time to figure out how I'm supposed to get all the things done that I need to get done in a day just to function as a human and as a student. It can be really challenging. You have a lot of demands and expectations to meet. So take some time for yourself, and that's okay. Don't feel too guilty about it. You will make up for it later as long as you have a solid study plan and strategy. So give yourself time to feel a little bit overwhelmed. It's natural. Every single student I know that starts third year is overwhelmed, but everybody falls into the groove. Everybody gets to step two, and we go from there. So that's okay. The rest of it is going to be figuring out your groove. Once you start getting into things, the thing that I find reassuring about step two and third year in general is that you don't need as many resources to succeed as in step one. So you don't have to juggle first aid and U World and watching, boards and beyond videos, etc. For step two, it's very simple. It's not easy, but it is simple. You need to do your world questions. You need to be an active, engaged learner throughout the day so you can pick up some clinical information to apply to your exam. And that's about it. You can use some video resources here and there, brush up on your weaknesses, but there's really one thing you need to do that's been tried and true. It's you do your world questions, you learn from them. You can do some flashcards like Anki if you want to brush up on your weaknesses and kind of keep track of all of your information as you go throughout the year, but you don't have to do too much else. So don't feel like you have to buy all the new, resources and books and drown in the material. It's just like starting first year. It's challenging, it's overwhelming. There's a lot out there, but you ended up figuring it out, getting to, step one and beyond. So the same cycle is going to repeat itself.
Right. So I think that's a great springboard into another one of our questions, which is UWorld has this interesting feature on the Step 2 CK Bank that is a shelf exam review feature. So I'm just wondering, first of all, I guess this is a two-pronged question. My first thought is if this feature is included on the Step 2 CK Bank and not a totally separate Q bank of its own, how much overlap is there between your shelf exams and your actual step 2 CK exam?
So I think that's a good question. In terms of UWorld and step two, I think there's a great correlation. In terms of UWorld and step two versus shelf exams, I don't think there's much of a correlation. And I think
Okay.
students will agree with me that NBMEs and exams administered by the NBME tend to be their own beast. So I find that students who, for example, are studying for step one or step two and taking NBME exams, they find that there's certain challenges, flaws, difficulties, whatever associated with those NBME exams. And in my experience, more fact-based, kind of less forgiving for mistakes and knowledge
Sure.
gaps, things like that, that are tend to, deflate your score. And then when you go to UWorld, you find things that are much more similar to step two or step one, where you have longer vignettes and more critical thinking. And so like step one, step two falls somewhere in the middle. So I will say that I really like the shelf exam feature because I did not have that when I did my third year. And like I was mentioning earlier, I started on family medicine and I had no idea how to study for that because there was no specific family medicine block on UWorld. And so I tried to do some of the internal medicine questions, but I felt overwhelmed there. I tried to do some surgery questions because I knew that was relevant. I got overwhelmed there. Same thing with pediatrics, etc. But now with the UWorld Shelf Exam Review feature, you can just do for example, ambulatory medicine, and you actually do questions that are strictly relevant to your upcoming shelf. So I still think UWorld does a fantastic job of covering all the high yield material, getting you as ready for your shelf as possible. But like I mentioned, as with step one, NBME and shelf exams tend to be their own beast. So it's a little bit more about fact-based kind of thinking. And of course, they're all integrated. So unfortunately, some things happen where, if you have internal medicine first and then you get some surgery questions on there or vice versa, you're going to be less likely to get them because you haven't experienced that yet. And thankfully, they have, scaling correction throughout the year for everyone's score. So people who take exams earlier in the year versus later in the year have completely different scales. But in general, I think that's kind of my thoughts on the shelf exam review feature. I think it's very helpful, but unfortunately, shelf by itself tends to be its own beast as usual.
I just want to talk about for a second here. So, what are the best resources to study for Step 2 CK? You mentioned previously that you don't need quite as many as for USMLE Step 1, you mentioned a little bit definitely of the UWorld QBank, kind of touched on boards and beyond, some of that stuff, but I think it was in the context of Step 1. So could you just clarify what should students really be looking at when they're studying for Step 2 CK?
Yeah, absolutely. So, yeah, one thing I'm happy to always talk about is that step two is much more simple in terms of studying, in the sense that students are very familiar with what they're supposed to be doing. Doing your world questions is going to be the number one thing throughout the year. Trying to keep up with them when you're in, that respective rotation is going to keep you afloat. And so I always recommend students do one full pass of UWorld before their dedicated period to study for step two. And then as soon as their dedicated period starts, ideally around 4 to 5 weeks long, they can reset and then start over. That's going to be the core of everything. One thing that frustrated me about step two that I warn a lot of other students about is that there's still a lot of fact based recall, and there's still a lot of memorization. Unfortunately, I had a few questions on simple gene rearrangements and enzyme deficiencies on my step two, which some people tend to think is gone after you're done with step one, but unfortunately they still come back. So my other advice for resources is to keep up with Anki if you're using it, and if you're not using Anki, I would recommend that you definitely start. And there's a lot of good resources online, and then even on our website, about how best to use Anki to study for
Definitely.
step one and step two. Yeah. And so I think Anki is the best way to keep up with the clinical nature of step two, meaning, flow charts, diagrams, what to do when you have certain scenarios, what are the next best steps, because those are really high yield questions that you get on step two CK. And then also using those to keep up with some of the smaller details of the minutia of medicine that we tend to kind of study for step one and then almost sometimes forget. And there's a lot of great pre-made decks out there that are available that I think most students know about. And then obviously you can make your own cards as well, and maybe the best strategy is somewhere in between, who knows. One thing I'll warn students about is not to rely on online med-ed too much, not to knock it as
Okay.
a resource. It's a good resource, I use it, but I think it's more about it's more useful for getting you on your feet when you first start a rotation
Mm.
and helping you understand what are the basics of that specialty. So peds, OB-GYN, repro, etc. It will teach you the basics to function on a medical student level. However, it does not give you the details that you need to do well on your shelf exams and
Okay.
step two. It's much too broad of a resource. So it has its place, but I don't want students to rely on it to do very well on step two. And I know that that's still kind of a gold standard resource that a lot of students are using. So I want to urge against that. And then from a textbook perspective, I really am not a fan of textbooks, especially for step two. The two bigger ones out there are Step Up to Medicine or Step Up to Step 2 CK, and then also the I believe it's called I actually forget now. It's by Conrad Fisher.
No problem. There's
It's called
another one.
Master of the Boards. Master of the Boards.
Okay.
Yeah. And so I don't think there's anything wrong with those books. I just don't think that there's much utility in them at this point. UWorld will teach you all you need to know and more. And it can just be too overwhelming to go through those books. I also think they're a little bit too zoomed out for a perspective. So it can be useful for kind of keeping up with knowledge throughout the year, but I don't think it's a great study resource. And then finally, there's I think one or two resources that are not fully vetted yet. So you had brought up Boards and Beyond in relation to what I had said about step one.
Yeah.
Boards and Beyond step two is out and then continually being expanded. I think I'd actually reviewed that on a different post as well. And I like that resource. However, I just don't think it's robust or built enough yet for
Sure.
step two. And so I still caution students against it. You can definitely use it and get the benefit out of it, but it's just not comprehensive enough that I would say that this needs to be a staple in everyone's kind of UWorld or step two studying set.
Great. Yeah, I think from the medical education side of things, really the latest trends and research in learning in medical school really indicates that it's so important to just dive into questions. Use that as like pre-testing. Don't worry about the percentage that you're getting wrong.
Mhm.
Just like hammer through it, and that will really help you to learn from your mistakes and get where you need to be. So I think it's really relevant what you're saying about how UWorld QBank or just whatever QBank you're using should really be the focus of your review, and then everything else can be kind of supplementary and as needed here and there. But that really active learning methodology is very important, not just studying for Step 2 CK and your shelf exams, but all exams throughout medical school. And certainly you know that being a tutor with Elite Medical Prep. So wonderful. Well, that was all of the questions that I had for today. Thank you again so much for being here and answering these questions. I think you were able to provide a whole lot of really valuable insight. So thank you again for that.
Thank you so much for having me. It was a pleasure.
Wonderful. Thanks so much. All right, thank you so much to Jaree for answering the questions that we had about how to simultaneously study for USMLE Step 2 CK and your shelf exams. I hope that everything that you wanted to know and more was covered in that video. If you've stayed until now, thank you so much for watching. Make sure to hit the like, hit the subscribe button on the Elite Medical Prep YouTube channel. We're always making these kind of videos. Send us any questions that you have. We would be more than happy to answer. So have a great day. Thanks so much.